How many of you in this room snore loudly at night or have been awoken in the middle of the night by a loved one snoring? I'm sure plenty, if not all of you. While this is annoying, somewhat funny, there could be a really serious underlying issue causing the snoring called obstructive sleep apnea. Today, I'm going to talk about an invention that is used in my field of work as a respiratory therapist that helps alleviate obstructive sleep apnea, called CPAP. I'm going to explain exactly what CPAP is, CPAP's inception into the medical field, what CPAP treats, and the side effects of CPAP. First, what exactly is CPAP? The National Heart, Lung, and Blood Association of America defines CPAP as constant positive airway pressure that delivers short bursts of controlled air to control your upper airway system. What CPAP treats? First and foremost, CPAP treats obstructive sleep apnea. This is a disease where you literally stop breathing in the middle of the night due to your upper airway being blocked by soft tissue such as your tongue and your soft palate. Now, while this doesn't sound very serious because we only snore through this and we'll start breathing again, this kind of stuff can lead to hypertension, diabetes, congestive heart failure, and obesity. The Orange County Medical Protocol Handbook says that we can also use CPAP in emergent situations. We've had several patients out in the field that are having complications due to congestive heart failure, such as blood backing up into the right lung. When this happens, we immediately put the CPAP mask on them, and within minutes, their lungs clear up, saving their life. The early beginnings of CPAP. ResMed.org credits Dr. Colin Sullivan of Sydney, Australia in 1980 of creating CPAP. He initially studied this on dogs by doing a tracheotomy, shoving a tube down their oral pharynx. Unfortunately, after his studies were done, he had to put the dogs to sleep. So he developed a mask by pouring plaster over the dog's mouth, making a fiberglass cast, and it gave him the same results without having to, unfortunately, put the dog down. He eventually turned these studies over to human trials. He took 30 people of different walks of life, different ages, cultures, backgrounds, and applied the CPAP mask to them to see if it would treat complications due to sleep apnea. In adults, he took people that were having troubles in their careers from lack of productivity due to fatigue or falling asleep at work. In children, he took a group of children that had been misdiagnosed as mentally retarded, mentally challenged, or having learning disabilities because of falling asleep at school or lack of cognitive results due to fatigue. After only 3 days, it was shown that the majority of these symptoms subsided in both children and adults. Normally, these results would have only been obtained through a tracheotomy in these humans, which, as you know, is a very invasive, life-altering event. While the benefits of CPAP are great, the side effects are thankfully menial. Side effects include nasal congestion, runny nose, and claustrophobia. Like us, the side effects and the experience they give us are quite unique. Some go away within days, some months, some years. In closing, I've told you what CPAP is, I've told you who and when it was invented, what it treats, and the side effects of CPAP. Thank you so much.
You did better. It was 30 seconds longer. I would talk a little